community and economic development. And Ricardo also shares the racial equity goals of our administration and values promoting diversity, uniting communities, and closing gaps in the racial health disparities. And he has become known as a leading quality education advocate in Milwaukee. And he has served on many local boards that include Alverno College, the Green Bay Packers, the Medical College of Wisconsin, as well as Schools That Can. So I'm really confident with his addition to this process, we will ensure we make fiscally responsible decisions that help county residents recover from the impacts of this pandemic. So today is really short for me. So with that, I'd like to hand it over to Mayor Baird. Mayor.
Well, thank you very much, Mr. County Executive. Good afternoon, everyone. This week, I've been sharing my spending priorities for Milwaukee, the city of Milwaukee's allocation of federal American Rescue Plan Act dollars. As many of you know, we will be receiving $394 million. We've received, just as the county has, the first allocation. And our first allocation that we took as a city was $3.8 million that the Common Council has already approved. And that's going to go towards summer jobs, our summer Earn and Learn program, because I think it's imperative that we do everything we can for the young people in this community, that we create hope and opportunity for them. And I wanted to get that money working as quickly as possible. With $394 million, we have 4 and perhaps even 6 years to spend the entire amount of this money. And so we don't have to rush to get the money out the door. At the same time, having talked to many residents, having talked to members of the Common Council, having talked to other individuals who have raised concerns, there is the feeling that I certainly share that there are certain priorities where we want to move rather quickly. And to address those concerns, this week I am introducing more specific language about what my priorities are for what I would consider to be a high priority summer package that will spend a little bit north of $80 million to address issues now. That, of course, will leave over $300 million for more community input, for more Common Council involvement as we move forward over the next few years. But the money has been directed to local governments to address the outcomes of the pandemic, both in terms of public health and the economy. And for that reason, I am prioritizing funds to support housing, jobs, and workforce development, to address reckless driving, public safety, and community-focused initiatives, among others. This funding will provide us really with an opportunity to support lasting change in Milwaukee. It's a once-in-a-generation chance to address major challenges the city faces. So the package that I have been rolling out this week will go to the Common Council, and hopefully it'll get a warm reception there as we try to address a lot of the aftermath of the pandemic and a lot of the issues that were created either before or during the pandemic that we know have to be resolved. I'd like to turn now specifically to the COVID-19 gating metrics to provide you an update on our gating metrics. We remain in the moderate transmission category for COVID-19 cases per 100,000, up to 23.2 cases per 100,000. As you may recall, several weeks ago, we dipped into that low transmission category for a week or two. I'd love to get us back to that low transmission category, but we are now at 23.2 cases per 100,000. Our percent positivity rate remains in the low transmission category, now at 2.8%. Again, I'm happy to be in the low transmission rate, but low transmission category, but we know just in the last few weeks, we were much, much lower than this. When I say much, much lower, we're closer to 1%. Now we are at 2.8%. So people should be concerned about that. Our vaccination rates continue to creep up. We're at 49.3% of city of Milwaukee adults, individuals 16 or older who are fully vaccinated, and 53.5% of adults have received at least 1 dose. There is a noticeable trend upwards in reported COVID-19 cases, and that is a concern. But it's also important to put these numbers in perspective. We are still down very significantly where we were several months ago. Again, I don't like to see us go up at all, but we remain much lower than we were several months ago, although we're higher than we were in the past several weeks. The most important thing I can say is that vaccinations work. They are safe, and they remain without a doubt our best approach to crushing COVID-19 in our city. So To address this, we will continue to partner with some of our greatest community partners. And as we continue to root on the Bucks during the NBA Finals, I want to again share this amazing opportunity to get inside the Fiserv Forum for Game 4 on Wednesday. So the Milwaukee Health Department will be at the Fiserv Forum Plaza administering vaccinations, and those who receive a vaccination will be entered into a giveaway for not one, but 2 free tickets to the game, to Wednesday's game. You show up, you get the vaccination, you're entered into a drawing to get 2 free tickets for tomorrow night's game. Take advantage of this incredible opportunity to keep yourself and your community safe from COVID-19 and cheer on the Milwaukee Bucks. If you are ever looking for a win-win situation, this is a win-win situation. So my request is you get the shot, you win the tickets, you go to the game, and then you guarantee me that we'll win. That's what I'm looking for. So whoever that person is, please do that. That's what I'm asking for tomorrow. Finally, last week we announced a new stage in our response to the pandemic. Our community mobilizer efforts of going door to door with vaccine in areas with low vaccination rates. And I want to thank the county executive. They've been a fabulous partner on this. The Medical College of Wisconsin has been a great partner. The Vaccine Integrated Communications, Outreach, and Mobilization Team, Jump at the Sun Consultants, and other community and civic partners are working together to bring the COVID-19 vaccination to every eligible person who wants it. To do this, our mobilizer teams are listening, answering questions, and sharing information based on science. In addition, our Milwaukee Health Department staff are accompanying mobilizers to provide on-the-spot vaccinations to residents. Both Johnson & Johnson and Pfizer vaccines are available. For those receiving Pfizer, staff will return to the resident's home to administer a second dose. And this approach is working. It's slow. It's actually a lot of work, but we think it's worthwhile because as of yesterday, July 12th, the health department has administered 208 vaccinations. So we are literally on the ground giving out these vaccinations in the neighborhoods where they're most needed. In addition, the fire department, and thank you to the fire department, the staff from the fire department has been part of the mobilizer team to monitor vaccinations. While there, they are installing smoke detectors for residents who need them. So through the door-to-door effort, 221 smoke detectors have been installed. So you can see we care about safety, we care about health, particularly as we try to work through these neighborhoods where we see the greatest need. So a lot of work is going on, and we're pleased to continue the teamwork that we've had. And with that, I will turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 26 new cases per day and about 1 death every 2 days. And we're starting to see an uptick in the county in cases and positivity. So in the last 2 weeks, we've seen a 3-fold increase in cases from 9 per day to that 26 per day right now, and nearly a 4-fold increase in positivity from 0.7% to 2.7%. And it certainly may be tempting to attribute these changes to the natural fluctuations in disease burden. However, when we look at the broader trends nationally, we see a clearer picture, one of a true and substantial increase in disease burden. So statewide, we're seeing a similar doubling in cases as well as positivity. And nationally, we see the same trend. We've gone from about 11,000 cases per day in June to over 23,000 cases per day now in our country. In fact, at this point, all but 4 states are showing increases in cases over the last 2 weeks, all but 4 states. And concerningly, 28 states are showing an increase in hospitalizations over that period as well. Now, of note, the states with the lowest level of vaccination, states like Alabama, Mississippi, Arkansas, Tennessee, these are also among the states that are seeing the greatest increases in case numbers. So with all the vaccine going around, why are we seeing this rise in cases? The answer seems to be fairly straightforward, and that's the Delta variant. So when we look at the prevalence of the Delta variant in the United States, we're just a few weeks behind the UK. So the UK is now well over 90% Delta variant in their virus makeup. And to understand how this extremely transmissible and extremely dangerous variant can affect a country, we saw in the UK their cases per day go from 2,000 2 months ago to over 30,000 cases per day now, making them extend and reconsider their lockdown policies. Now, of note, the UK also has a higher percentage of their population vaccinated than the United States. So unfortunately, COVID is not over. And as expected, the Delta strain is around 60% or so of cases on average in the United States. Now, presuming we follow the trajectory of other countries, it'll soon be greater than 90% of cases in our country. We need to look no further than just 2 states south of us in Missouri to see what a dangerous scenario with the Delta variant can look like. Missouri now has 96% of their virus being the Delta variant. And as a result of this, are seeing hospitalization numbers rivaling their previous high, now leading to ventilator shortages, something we all thought we were long past. Now, nationally, 43% of those hospitalized in the United States with COVID are 18 to 49 years old, higher than it's been at any other point. So the Delta variant is 50% more transmissible than the previous Alpha variant, and evidence suggests that it's also more likely to result in the hospitalization that we're seeing. So the solution here is, of course, vaccination. The vaccines are still quite effective against the Delta variant. And as cases rise across the country and the world, and as this variant is circulating widely, now is the time to seek out vaccine if you've not already done so. The large number of unvaccinated individuals, along with the increasingly prevalent Delta variant, is a dangerous combination that can easily bring us back to a point of increased disease burden like we're seeing in Missouri. However, we can continue Wisconsin and Milwaukee County's promising trends up to this point, but that means increasing our vaccination rates. As always, visit healthymke.com. You can find a fast, easy, always free vaccination near you. Thank you and stay safe, and I'll hand it to Health Officer Roush.
Thank you, Dr. Weston, and it's my pleasure to join today to talk a little bit more about COVID and what we can anticipate for the 21-22 school year. So as was noted on the media briefing notes for today, there was new school guidance issued from the Centers for Disease Control and Prevention last Friday. And for many of us who've been tracking and following COVID-19 for the past 17, 18 months, the information put in that plan of guidance wasn't really surprising. We know what works to control COVID, and we've been working on that for many, many months. As Dr. Weston mentioned, vaccination remains one of the most important prevention strategies for those currently eligible to receive vaccine. So in the school setting, if we think about teachers and staff and other faculty, they're eligible for vaccination. They're over the age of 12. In our middle schools and high schools, we will have kids that will be vaccinated and we will have kids that are not, but everyone is eligible, and the message continues to be to continue to get your vaccination. The most concerning part of K-12 schools for me as a local health officer really is focused on elementary schools. And I myself have a 10-year-old daughter who is not yet eligible for vaccination. So in the school guidance that many of us support, as well as the Wisconsin Department of Health Services has endorsed, and will be coming out with some clarifying Wisconsin documents in the coming days and weeks, we continue to see things mentioned about layering protections to mitigate COVID-19. So one of those protections we've talked about before is masks, and continuing to wear masks in the school setting if people are not fully vaccinated. In the school setting, because of space constraints, the CDC has changed the definition of close contact and is now recommending a minimum distance of at least 3 feet in schools. So as such, in the school setting, the definition of a close contact will change to be somebody exposed to somebody with COVID-19 that has a lab-confirmed test for 15 minutes or more. And particularly, we know in some school environments that it's difficult to maintain a physical distance of 3 feet at all times. And this is where it will be very important to layer those other mitigation and prevention measures. Thinking about things like surveillance and testing, thinking about ventilation in the schools, thinking about increased continued hand washing and hygiene, thinking about things like staying home when you're sick, getting tested if you show symptoms, and then a real big focus on contact tracing, disease investigation with isolation and quarantine identified as necessary. And the quarantine of close contacts in the school setting will continue to be a necessary and important step to control disease, because that's a way of identifying people who've been exposed and restricting their movements so they're not spreading disease to other individuals unknowingly. In total, schools are a very important part of the overall community, and similarly, they play a very strong role in the control of COVID-19. And yes, it's only mid-July, and it's probably a little bit early to think about school going back in session, unless you're a parent who's maybe now sick of your children being home for the summer. However, we do know that with the release of this guidance from the CDC in the past week, and local health officials like me engaging in conversations with our schools, we have ample time to plan to protect our kids going into fall. So as I said, schools remain a very important piece of this puzzle. We want to control disease transmission everywhere, but most importantly, we want to control disease in those elementary schools, like I talked about, where there's going to be a lot of people, mostly children under the age of 12, who are unvaccinated. And we want to protect those persons, those students, because they could be bringing disease back into homes, to their grandparents, etc. So while the guidance is that, it's guidance from the Centers for Disease Control, we hope that school leaders and school boards will continue to implement and create policies that support in-person learning in a manner that also keeps all of their students, faculty, and staff safe in the midst of this ongoing pandemic. Thank you very much, and I'll now turn the briefing over to Catherine.
Thank you, Director Rausch. We'll now move to the media Q&A portion of our briefing. And our first two questions come from Sharon Bajenda with CBS 58. The first question appears to be for health experts, the second for the mayor. The first one is, what do you think is contributing to the slight increase in the city of Milwaukee? And for Mayor Barrett, are you concerned about large gatherings in the Deer District contributing to case number increases?
So with the first question, I think we're seeing increases because of the Delta variant. It's a variant unlike anything we've seen with COVID before. It's significantly more transmissible, which means if you're in the same sort of situation with someone who has COVID now as you were a year ago, you're far more likely to catch COVID now than you were at that point. And that leads to increased transmission. And when we have a fairly sizable unvaccinated population in Wisconsin, in Milwaukee County, in the city, take your pick, it's easy for the virus to spread. And I think that's why we're seeing increased numbers.
And I'll address the second one. To the extent that people are not vaccinated, I'm very concerned, not only at the gatherings in the Deer District, but anywhere, because the evidence is so clear that if you're vaccinated, you are infinitesimally more likely to be safe than if you're not vaccinated. So for those individuals who are not vaccinated that are going to these large gatherings, I'm very concerned. I'm very concerned about them. But to the extent that people are vaccinated, again, I'm going to rely on the science that you're in a much better situation then.
Thank you both. Those are the questions I've received thus far in the chat. I'll give it just one more minute to see if there's any additional questions. Otherwise, we'll conclude the briefing. For media joining, please just make sure to send your question via the chat box. All right. Sharon is also wondering, Dr. Weston, if you could expand on the J&J side effects.
Sure. So I think the side effect we're talking about is Guillain-Barré, which is a nerve issue where you have nerve deficits. And so what the CDC said is that the Johnson & Johnson vaccine seems to have some association with Guillain-Barré, which other vaccines similar to Johnson & Johnson in the past have as well. Now, I think it's worth looking at some numbers here, and we try not to get bogged down in the numbers, but I think this one is important to understand the odds. So when you look at the chances of getting this Guillain-Barré syndrome from the vaccine, which of note is typically mild, typically self-resolves, the chances of getting it are 8 in 10,000. So that's about 0.0008%, okay? And then when you think of, we've heard about the blood clots with J&J, that's slightly less likely, 0.0007% chance. Of note, the chance of being struck by lightning in your life is 0.007. So you have about 10 times the chance of being struck by lightning in your life than you do of contracting either of those two issues if you got the Johnson & Johnson vaccine. Now, to contrast that, the chances of dying if you get COVID, when we look at the population in the United States, is about 2%. Not even comparable numbers. We're talking about thousands of times greater chance. The chances of getting long COVID, so having potentially debilitating headaches, shortness of breath, brain fog, all these sorts of things, whether in adults or children, but in adults is around 30%. So a very high chance. And if we're talking odds, the chances of getting a Bucks ticket by going and getting vaccinated is probably higher than any of those. So anyhow, the point is we have to think about the risk level here. And nothing in life is without some level of risk, but the benefits of getting these vaccines so far outweigh any possible negatives that it's a negligible comparison.
Thank you, Dr. Weston. Those appear to be all of the questions we have for today. So thank you all for joining, and we will see you next week.
Thank you all.
Go Bucks.
Thanks, everybody. Go
Bye-bye.
Bucks.
Go Bucks.
Thank you.